Welcome to The Explainer. Today, we're going to tackle a topic that is just full of old wives' tales and honestly some pretty confusing advice: getting pregnant.
I mean, when you're trying to conceive, it feels like everyone has a piece of advice for you, right? Your aunt, that person in an online forum. The tips just keep coming. And look, some of this stuff is harmless, maybe even a little silly, but a lot of it can be genuinely misleading, and it just adds a whole layer of stress and confusion to what can already be a really emotional time. All of this advice, coming from all directions, creates this kind of fertility fog. It makes it so hard to figure out what's real and what's just, well, noise. So in this explainer, we're going to cut right through that fog. We are going to separate the hard facts from the fiction using real, actual science. All right, first up, let's tackle one of the biggest, most persistent, and honestly most damaging myths out there: the idea that fertility is just a woman's issue. I mean, for decades, that's been the story, right? The burden was placed almost entirely on one person. But just look at this. This data completely shatters that old idea. The causes of infertility are split almost perfectly into thirds. About a third of the time, it's a male factor. A third of the time, it's a female factor. And the last third, it's either a combination of both, or sometimes it's just unexplained. So what does this all mean? It means fertility is a team sport. It's not about one person, it's about a couple. It really needs a team approach for everything from the initial checkup to ongoing support. Pointing fingers, it's not just unhelpful, it's flat out wrong, scientifically speaking. And this is a really big one that often gets completely overlooked. We hear so much about a woman's biological clock, right? But male fertility isn't timeless either. The research is clear. Sperm quality and quantity can definitely decline as men get older, especially after they hit 40. Okay, so now let's get into the nitty-gritty of, well, the mechanics and biology of it all. We're going to bust some of the most common old wives' tales that you've probably heard a million times. Okay, I am almost certain you've heard this one, that certain sex positions are better for getting pregnant. Oh, and of course the whole lie down with your legs in the air thing afterwards. But what does the science actually say? Well, according to Dr. Kayani, there's just no evidence to support it. Ejaculated sperm can be found at the cervix within seconds, no matter what position you're in. The bottom line is, sperm are incredible swimmers. They are literally designed for this journey and don't need any help from gravity. So yeah, the scientist is really clear on this one. No position has ever been proven to boost your chances. Okay, this next one is a huge source of anxiety for so many people. It's this persistent fear that if you've been on hormonal birth control for years, you've somehow messed up your chances of getting pregnant later. Well, you can breathe a sigh of relief because that fear is totally unfounded. Your body is incredibly resilient. Sure, it might take a few months for your cycle to regulate and get back to its normal rhythm after you stop, but study after study shows absolutely no link between using birth control and future infertility. The fertility cliff. This has to be one of the most dramatic and, let's be honest, terrifying myths out there. It paints this scary picture of your fertility just plummeting the second you blow out the candles on your 35th birthday. So let's look at the actual numbers. According to the CDC, about 1 in 6 couples where the woman is 35 or older have some issues. Now, yes, fertility does decline gradually with age, but let's flip that number around. It means the vast majority, 5 out of 6 couples over 35, don't have fertility problems. So it's much more of a gradual slope, not this terrifying cliff. All right, finally, let's talk about 2 of the biggest sources of stress and misinformation: that classic just relax advice and the idea that getting help is just too expensive. I think anyone who's been on this journey for a little while has heard this one: just relax and it'll happen. But is stress really the thing that's stopping you from getting pregnant? Okay, let's be super clear here. The evidence is overwhelming. Infertility is a medical condition that causes stress, not the other way around. The stress is a symptom of the struggle, not the cause of it. And while, yeah, managing stress is great for your health in general, it is absolutely not a cure for a medical condition. Now, what about treatment? There's this huge myth that if you need help, your only option is IVF, and that it's going to be incredibly expensive. This idea honestly stops a lot of people from even seeking help in the first place, and it's just not true. Because look at this chart. It shows that the vast majority of cases, we're talking 85 to 90%, are successfully treated with what are called conventional therapies. These are things like medication or minor surgeries that are way less invasive and a lot less expensive. IVF is an amazing, vital tool for sure, but it is rarely the first step. And this quote from Dr. Kayani really brings it home. The truth is, not everyone can get pregnant even with interventions. Those experiencing infertility should not feel as if they are to blame or aren't trying hard enough. It's so vital to remember that this journey is complex and it's different for everyone. It's okay to seek support, and you should never, ever feel like you're to blame. So here's the big takeaway from all of this. Fertility is just a part of your overall health. It is not some kind of test of your lifestyle, and it's certainly not a reflection of who you are as a person. When you focus on the real, science-backed facts, you can make decisions with confidence. So, now that we've busted all these myths, what's the most important first step you can actually take on your fertility journey? Well, for most people, the answer is pretty simple. Just start a conversation. Talk to a doctor or a healthcare provider you trust. They can give you personalized, factual guidance that's just for you. That is the best way to cut through all the noise. Thanks so much for watching.